This skill is assisting a patient with ambulation using a cane. First, you're going to perform hand hygiene. Make sure that the patient's holding the cane in his or her stronger side, close to the body, and then the nurse stands to the other side and slightly behind the patient. Tell the patient to advance the cane 4 to 12 inches, and then while supporting his or her weight on the stronger leg and the cane, advance the weaker foot forward, parallel with the cane. While supporting his or her weight on the weaker leg and the cane, have the patient advance the stronger leg forward ahead of the cane. Tell the patient to move the weaker leg forward until it is even with the stronger leg, and then advance the cane again. The first thing you're going to do is perform hand hygiene, identify your patient, and explain to them what you're going to be doing and how far you're going to be walking. In this situation, we're going to have the patient already out of the bed, standing up. We are going to put the gait belt around them and make sure that we are really close to the gait belt at all times. Now we're going to assist the patient first with a 2-point gait, and this is used when they're doing partial weight bearing both feet. Have the patient move the left crutch and the right foot forward about 12 inches at the same time. Now have the patient move the right crutch and left leg forward to the level of the left crutch at the same time. Okay. And this is the 2-point gait. So now we're going to do the 3-point gait. Have the patient move the affected leg and both crutches forward about 12 inches. Have the patient move the stronger leg forward to the level of the crutches. Now the 4-point gait. Have the patient move the right crutch forward 12 inches and then move the left foot forward to the level of the right crutch. Then have the patient move the left crutch forward 12 inches and then move the right foot forward to the level of the left crutch. The last one we're going to go over is the swing to or swing through. This is when you have the patient move both crutches forward about 12 inches and then have the patient lift the legs and swing them to the crutches, supporting his or her body weight on the crutches. This skill is assisting a patient with ambulation using a walker. Perform hand hygiene. Wrap the gait belt around the patient's waist. Place the walker directly in front of the patient. The nurse needs to stand on the weaker side. You want the patient to move the walker forward 6 to 8 inches and set it down, making sure all 4 feet of the walker stay on the floor. Then tell the patient to step forward with the weaker leg into the walker, supporting herself with her arms. Follow through the other leg. Move the walker forward again and continue the same pattern.